Okay, let's go ahead and get started. Our chaplain, Nancy.
Well, there she is.
Oh, okay. Okay.
Is this working? Good evening, everybody. I'm glad to be here with you. This is a busy and stressful time for most everyone in this room, for true. And I thought today that I would offer to you, this is our wrapping up of our student time as chaplain students. One of the things the board and other people help us offer in spiritual care is education, clinical education for ministers, clergy, etc. Today is one of our group's last meetings. And so I said, if you wanted to say a sentence to the board, what would you say? So I'm going to read those in honor of the board and of other folks who support our students and our program and really spiritual care here at Erlanger. So they're just very brief, I promise. You might be interested, this group did 18 24-hour Sunday on-calls for us. They did 36 weeknight on-calls for us. So they were a hard-working group. The first person says, in my time in CPE, clinical pastoral education, I've been confronted with the frailty of our lives and the lasting, profound, and meaningful effect of compassion. CPE has helped me to better myself with reflection personally and using this to reach out and make a difference in the lives of others. Thank you for permitting me access to this life-changing journey. It has been a pleasure to serve at Erlanger. The CPE program is unique and I learned so many things in spiritual care. Thank you for the program. And this last one I especially like. I've been inspired to serve all people, regardless of ability to pay, and honored to hear their stories. Erlanger gives me hope for the world. Amen. Thank you.
Thank you, Nancy. Okay, Sheila has something she would like to say.
Yes, I think most people know. I know Kevin does. Yesterday was Administrative Assistance Day, but Kitty, she's always working. I just wanted to say on behalf of the board, I'm sure, and the rest of everybody in this room, how much we appreciate all of
Thank you.
Ask her how late she worked yesterday.
I know. We get emails from her all the time. I'm like, do you have a life outside of here?
And phone calls. Okay, Dr. Keys.
Good evening, and thank you, Mr. Chairman. This evening, I want to put the spotlight on the more than 30 years of service that Erlanger's trauma team has given to Erlanger and the region. Hospitals, as you know, are not all the same, and it does matter where a patient chooses to go or an event they're not able to choose where they are brought, because they could be in their most vulnerable moment and never more so than when an accident or injury occurs. We have just a very brief video, and then I'm going to ask Dr. Barker and the trauma team to come up. So Paula can start the video.
Your ambulance clearance report out of LA.
Their time is critical. There is no substitute for experience. The more you do it, the better you get at it. We've got an operating room available 24/7. It's set up, it's ready to go. We've been a level 1 trauma center for more than 30 years. It's challenging. You deal with some really sick folks, and you know that if you weren't there, they wouldn't be there. It takes a lot of people that converge on this trauma patient to provide care to them.
The thing that sets us apart for the adult side is that we have a group of 12 critical care trained nurses who will come take care of the trauma patient from when they arrive all the way through their stay. We also have 6 extremely dedicated surgeons who are really great clinicians, and knowing that we can provide that to the entire community.
Our children's hospital has been designed to take care of the children, of course, and take care of families. Children have a completely different physiology than adults. They have a completely different responses to blood loss, hypotension, and the way their heart responds to different stresses is completely different.
Our physicians in our emergency department, our attending physicians, are specially trained for pediatrics. So when you go to an adult hospital, you have a physician that is trained in adults mainly. But when you bring your kid here, our physicians are specially trained for pediatric care.
We are one of only 4 within the state that can provide the highest level of pediatric care in the state of Tennessee. You do get attached to these patients. They're our patients. We care about them. We care about them not just their medical care, but as a whole.
We really get to have hands-on care of all of our patients differently than most nurses. We take care of everybody as if they're our own family members.
Dr. Marker? As the team is coming up, I see that we're one short. I know that you all have heard about the red shirts and the gray shirt. Well, the gray shirt just got called away to a rapid response, but we do have the red shirt. So, Dr. Barker, I will let you introduce the team and just say a few words. I think we have your slides here. Also want to recognize Dr. Burns because I think he's also a big part of this and getting the trauma program started here at Erlanger. So I'll recognize
Well, this is just sort of, excuse me, the tip of the iceberg with all the folks that are involved with trauma care here. Angie is our administrator for our program. She has really been able to put this program on the right track. She worked very diligently hard at it, had great ideas, and we sure appreciate her being here. Kayla's our program, our trauma program manager, who is like the Energizer Bunny. She probably is a twin for Jeff Mescon, who's maybe one of the most energetic people I know. And Jill is one of the 12 red shirts who respond to all the traumas and really keep everything moving along like it should during the resuscitation phase. They also wear a gray shirt sometimes too, and they're the people that respond to all of the rapids within the hospital. If you'll let me do this, I will go through just a few slides. It's brief, but I thought it would be nice to sort of give the board an overview of what the trauma program is like here at Erlanger and what we do. So if I can make this slide projector work, we will go forward. We've been a Tennessee designated level 1 trauma center since August of 1988. Sorry. A Tennessee designated level 1 trauma center since August of 1988. However, we were a trauma center long before that because if you look back at history, that's why this hospital, at least by historical legend, was started when the Baroness gave the money to provide for the care of injured railway workers. So the roots for trauma care at this hospital run deep. We were an Alabama designated level 1 trauma center since 2012, and we anticipate American College of Surgeons verification in October of this year, and that's a big deal. That is the recognition by the American College of Surgeons that you meet the criteria to provide the highest level of trauma care, and it is a national standard. So we'll be very proud whenever we accomplish that. We do 3,500 adult trauma admissions a year. Those are trauma patients that are admitted to the hospital. We see a lot more than that in the emergency department. Some of those patients go home with more minor injuries. We have a 12-bed trauma ICU, a 10-bed surgical ICU spillover for trauma patients out of the 12 beds when it's full. We have an 8-bed neurotrauma ICU that we added in 2012, and we try to put the patients with significant head injuries
in that particular unit, so they get more specialized care. There's a 20-bed trauma step-down unit, an 18-bed trauma surgical floor. There is a 38-bed ortho trauma floor, and there are 6 trauma resuscitation bays in the emergency department. So it's a pretty active service, as you can see, with a lot of admissions. The clinical staff consists of 6 American Board of Surgery certified general surgeons. They're all University of Tennessee College of Medicine faculty and participate in teaching the residents and the medical students that come through here. And quite frankly, we probably couldn't do our job if it were not for our surgery residents who provide a lot of care for these patients throughout their hospital stay. All of these, our general surgeons are board certified in surgical critical care and responsible for all the aspects of trauma care here. We have 2 critical care fellows a year. We're very proud of those folks. Most of those folks that have finished this program have gone on to take academic positions in other trauma centers throughout the country. They're very prominent. Some of them are program directors, and some of them are trauma directors in various places throughout the country. We have 34 surgical residents. There is 1 trauma nurse practitioner. There is a trauma nurse navigator, and there are 12 critical care nurse clinicians, which are the red shirts and the blue shirts, depending on what their assignment is for the day. And I keep saying I would trade most everybody else in this hospital for those people, because they are the folks that really make it work, and they really do. They're really good. They allow us to get a critically injured patient out of that emergency room within 20 minutes, and that's quite a feat sometimes. The administrative staff, Associate Chief Nursing Officer, that's Angie Basham Safe, who has done an incredible job with this. There's a trauma medical director. I serve in that role, and I'm also the medical director for Life Force, so we participate in a lot of other activities in the hospital. There's an associate trauma medical director who's the ICU medical director and is the critical care fellowship director also. Also, a lot of the other guys serve on various committees throughout the hospital, pharmacy therapeutics, credentialing, various committees like that throughout the hospital. So we are integrated into the fabric of this place pretty heavily. The trauma program manager, who's Kayla Whitaker, who does an incredible job, has a lot of energy and really helped bring us along a long ways. We have 2 process improvement coordinators. There's a lot of chart review, a lot of quality assurance in this business that we have to do. There's an injury prevention coordinator, there's 1 research nurse, and we have 8 registrars, which is mandated by the state and mandated by the American College of Surgeons, 1 per every 500 to 750 trauma admissions a year. We keep a large database. We follow the CDC, Center for Disease Control's destination guidelines. Tennessee has adopted those, and that directs where patients go according to designation of the hospital by the state. The goal is to get the sickest patients to the highest level of care, and get the right patient to the right hospital at the right time. We do that through working with our ground ambulance services and through our air medical service. The trauma registry that I mentioned earlier contains a real detailed, reliable data set for the information we need for quality improvement and to identify various issues that need to be dealt with through the system. It improves the trauma systems. We can use it to help shape public policy and provides the opportunity to trauma centers to compare their outcomes both regionally and nationally. There are several data submissions that have to be done. We submit to the Trauma Quality Improvement Program through the American College of Surgeons. We get a nice printout quarterly on that, and it helps us compare ourselves to other hospitals throughout the country, and we compare quite admirably to everybody else. There's also a Tennessee TQIP, same report, just for Tennessee hospitals, and again, it allows us to be able to tweak things specifically for the state of Tennessee to make care better. We are required to have 20 peer-reviewed publications every 3 years. That's not an easy task. So the trauma registry is now up to date within just a few weeks, and I think the quality of it will allow us to do better research than what we've done in the past. It also helps us with process improvement to track and trend data, identify injuries, trends, so we can target injury prevention towards those. And we are required by the state to submit data to the state on a quarterly basis as part of our trauma designation through the state. And there are also internal hospital data uses that this database can be used for. We have a vigorous process improvement program. We have a multidisciplinary trauma peer review committee that meets on a monthly basis, and we review actually patient care and patient cases in that committee. A lot of people participate in that: orthopedists, plastic surgeons, anesthesia. We've added a hospitalist to that, radiology. Pretty much all the specialties are there throughout the hospital, and it's a vigorous program. We also have the folks there from the Quality Improvement Office to help us score these cases as we go through them. Trauma process improvement and patient safety meets monthly and deals with systems issues. And again, it's pretty much the directors of all the different departments in the hospital where we bring issues forward and try to solve them. Trauma process improvement meets weekly. We go through all the patients that were admitted over the past week and identify problems while they're fresh and try to channel those to places they need to go. And then the trauma committee that Dr. Burns chairs is an oversight committee that meets quarterly. Injury prevention, we've done Stop the Bleed. I'm sure you all have heard a lot about Stop the Bleed. We're actively involved with doing that, and through this program we've reached over 10,000 participants because it amplifies itself. Once you train people, it's easy to get more people out there, and this is a real critical thing. Mock crashes for local high schools, distracted driving events, motorcycle safety, and a matter of balance to try to keep people from falling down. The face of trauma has changed from 20 years ago when the typical trauma patient was a 35-year-old car wreck male, and now it's changed, if you look at the data, to an over 65-year-old female who has fallen. It's not the same as it was, and I think we're going to have to adapt to that some way, and I think there's an opportunity there for us to do that. Education, we do advanced trauma care for nurses 4 times a year. These are all standardized courses. Advanced trauma life support, or ATLS, we do 5 of those a year, including some instructor courses. We have people come from all over the country that come to those courses. The trauma nurse core course is done 4 times a year. We have a thing called Rural Trauma Team Development, which is a sort of a condensed ATLS course to help smaller hospitals deal with the flow of trauma patients through their hospitals and provide adequate and efficient care for those patients. It's really a good course, and we've got that cranked up, and we've done several of those already. We have the regional symposiums that Liz sets up for us. We do 4 of those a year where somebody from the trauma program, one of the docs, goes out and gives talks and so on behalf of the program and behalf of Erlanger Hospital. And the trauma symposium annually, which is a pretty big event. It's a 2-day event. It started in 2008. We have a lecture schedule one day, and there's a cadaver lab, which people sign up for from all over the country to come to that. To get some hands-on experience with cadavers. Attendance is over 200 people at each time, and it's a variety of healthcare providers participate in that with various topics that are pertinent to trauma care. Research, we have to have a lot of research articles. These articles are inclusive of all trauma specialties, orthopedics, plastics. Those folks help us out with those we need. Research has to be physician directed and requires a lot of support people, biostatisticians that we work with from UTC, research design, data collection, and publication. Our initiatives for 2019-21 include the ACS verification visit, which is scheduled in October, and hopefully 6 weeks after that we'll be able to come to you guys and say, we did really well. We really did really well on the consultative visit. So, and things are better than they were then, so I have no doubt that we will pass this with no problems. We need to look at creating a geriatric trauma program to take care of the changing face of trauma that gets presented to us with the aging of the population. We would like to have a research scientist position so we can meet our research goals. I think it's really important. Faculty and facility improvement, I think, would be important to help upgrade our trauma base and add additional trauma base, because we're really pretty busy, and sometimes trying to resuscitate patients in that small area gets really involved. And we also would like to help improve trauma care within the Erlanger system, because Erlanger now has a lot of hospitals, and it would a lot of those folks see trauma patients, and we would like to help improve that, so that these patients that do enter the system, no matter what hospital they come to, get optimal care. That's it. Thanks for your attention. Appreciate it.
Thank you, Dr. Barker, Dr. Keys. You know, we know how important the trauma program is here at Erlanger, but it's very helpful to get an overview like that. It's helpful to the board as well, just to understand what all goes into putting together a program like that. It's pretty amazing. Okay, I believe everybody has received the minutes from our March 28th meeting. If I could get a motion to approve those. Second. All in favor? Okay, and our committee reports, budget and finance, Henry?
We did meet, had a very good meeting. We've got a resolution coming up here in just a minute, but we had a chance to review the first quarter, the January through March quarterly report.
Okay.
Very good.
Okay. And Phil, I can answer that question. Phil's committee did meet.
We met Monday, thanks to you.
Yeah, I was there, yep. Audit and compliance, Gerald's not here. We did not meet, okay. Legal committee.
And we did not.
And MBEC did not meet, and executive committee has met. All right. I don't believe there's any unfinished business, so Dr. Jackson.
Thank you, Mr. Chairman. I'm bringing forward resolution number 190401. It's a resolution rescinding and replacing our prior resolution that authorized execution of a contract between the authority and Chattanooga Medical Realty, LLC, for medical office space. If you recall, in October, we introduced and the board approved resolution 1810-6, which was to enter into a lease agreement as part of our primary care access strategy for a lease with a total cost not to exceed $1,886,541. Due to some changes in the strategy and the scope and cost of what we want to do with the lease, we're bringing forward a request for authorization of an increase in this amount of $291,040 over the life of the lease. This is a 10-year lease. So the total would not exceed $2,177,581. Again, this is for part of our primary care strategy that is northeast of the location we're at presently. I'm happy to answer any questions about it.
I think we discussed this Monday night.
Yeah.
Yes, sir.
Does anyone else have any questions?
I don't have any questions. I'd like to make a motion, we approve the resolution.
Okay.
I will second.
All in favor? Thank you.
Thank you, Mr. Chairman.
Okay, Kitty, does everybody have copies of this board committee or not? Okay, everybody received, we welcomed Dr. Burns to the board last month, and so he's been assigned to 3 committees, I believe, and so we're going to, that got sent out, we kind of shuffled around a little bit, and but we approve this now whenever there's a change, correct? And so I believe we've added Dr. Burns to planning, audit, compliance, and legal, and he was willing to serve on those 3 committees. So, so we need to vote on that?
Yes, sir.
Okay. If I could get a motion to approve the changes to the board committee assignments.
So moved.
Okay.
Second.
Second. Okay. All in favor?
Aye.
Thank you. All right. And Dr. Bolton, do you have a report?
So I just have two things I want to mention. First, this weekend we're having a conference, educational conference for physicians, and we probably have 30 or 40 physicians signed up. The conference is about improvement, or looking at quality improvement operations. So we're hoping to move forward with that to make it a cleaner, more fair sort of system. And that's happening this weekend. And the other thing I'll mention, just someone else probably will, but as everybody knows, Woody Kennedy passed away this month. And he was a great educator, physician, and leader at the hospital. So I think the medical staff and hospital, I would hope, would find a way going forward of honoring him in some more permanent fashion. Still don't know how, but I think we'd like to
That's a
move
great
forward with
idea.
something like that.
We talked about it this morning and worked together to figure something out that's meaningful.
That's great. That's a great idea. Woody was the chief when I came on the board back in 2012.
Yeah.
So, yeah. All right, we'll definitely work with y'all on that for sure. All right, appreciate it. Dr. Schott.
Thank you, Mr. Chairman. Very brief report this afternoon. We are wrapping up the last of our chair searches here. We have replaced 6 chairs so far, and we're working on the 7th, which is a chair for Department of Orthopedics. We have an offer out to the individual that was selected. It was the first choice of the search committee and was approved by me and Mr. Spiegel. And we're hopeful that this individual will sign the offer and we'll have him in place in the next few months. It'll take him a while to get extricated from his current involvement up at the Mayo Clinic, but we hope that we can make this happen in a fairly expeditious fashion. And he's going to be great. He's going to be a wonderful addition to our faculty here. The only other thing I'll mention is that many of us here from the Chattanooga campus, Erlanger campus, will be going to Memphis next month for the University of Tennessee College of Medicine graduation ceremonies. And all of y'all are certainly invited if you want to come. And I apologize, I don't know the exact date right off the top of my head, but I can get it to you. But a bunch of us are going for the graduation ceremony next month in Memphis.
Okay.
That completes
Get
my report.
that date to Kitty and she can let us all know.
Yeah, I'll get the date to Kitty. She can let you all know.
Okay. Thank you.
Thank you, Michael.
Mr. Spiegel.
Mr. Chairman, thank you very much, and I also, Dr. Bolton's comments about Dr. Kennedy. He was past chief on the executive committee when I joined the staff. Been at his house several times for dinner, as Woody was wonderful in cooking on his green egg and inviting people to his house, and his family, and spent a lot of time together and worked together professionally and socially. And he is definitely going to be missed.
No doubt about it.
On a happier note, Judge Gerald Webb, we went to his confirmation hearing and ceremony, and he is an appointment as a general sessions court judge, and obviously he will be leaving because of his new position, but he will also be missed, but we are happy for him professionally that he has reached this pinnacle in his career. I had the pleasure of meeting with Governor Roy Cooper at our Western Carolina hospital. He visited this, and I didn't know this, but the history of Western Carolina, no governor has ever visited Murphy, North Carolina in the history, at least that people who are still alive can remember. But Governor Cooper went there. He is on a visiting campaign of visiting rural hospitals throughout the state of North Carolina, addressing access issues and understanding local critical access hospitals have been closing, and he wanted to also see what Western Carolina Hospital in Murphy is doing well. And personally went there, met myself, our board chairman, and the executive team. Mark Kimball, the CEO, presented him with a resolution supporting the governor's initiative of really helping rural hospitals throughout that state. Today, Senator Marsha Blackburn visited Erlanger. She came here to meet with us also wanted to thank us for visiting in Washington, being at the Tennessee Tuesday meetings and being part of that, and also being on the Hill discussing healthcare issues. And so she wanted to see it. She went to Iraq, looked around, wanted to see the Children's Outpatient Center that she's been hearing so much about, and she was really pleased. Got a couple of photos. They're going to be on, I think, our LinkedIn pages, and the hospital noticed that she actually came here. San Diego Zoo Kids Channel was implemented for the children in the Children's Hospital. This is being supported by the Ronald McDonald House, the Tennessee Aquarium, and the Chattanooga Zoo. So another real positive thing. Be careful what you wish for. You may get it, but Epic is going to be upgraded on May 19th. Don't say I didn't say anything, so you all know. One of the things that when we implemented Epic versus the other programs, the upgrades within Epic are free. It's included in the purchase price. But so then we will actually take those upgrades, but the problem is we have to train our staff all over again. It's an incremental upgrade. It doesn't affect everything, but there will be added features. One of the things that may affect everybody in this room is the added features to my chart. This is how you can access your medical record and see things. So there will be significant upgrades to that, and it's one of the most wonderful things we have. At the finance meeting, there was a read of the proposed budget, the second time. Next month is, I think, the final.
We have
Two more times, okay. Now, that's a lot of,
a
lot of reads of the budget. The proposed capital budget is $40 million. This encompasses approximately 105% of our current depreciation. Inpatient growth, approximately 4.4% growth in a flat market, and projected outpatient growth of 5.1%. There was a lot of discussion at the Finance Committee. Mr. Haas chairs that, but we are going to tweak it a little bit more and bring it back to the committee based on some of the recommendations. The annual Dragon Boat Festival is next month. This is an annual fundraiser. The location this year is at the TVA recreational area at the Chickamauga Dam on May 4th at 8 a.m. Everybody, please be there. I do need to recognize everybody from the Foundation Committee and our chairs for the Believe Bash. This was an unbelievable turnout of both physicians and staff and the community coming together to raise money for the Children's Hospital. It was held on April 6th for the first time at the Convention Center. It was an unbelievable turnout, and everybody had wonderful things to say about that. So thank everybody that's been part of that and everybody that attended. Mr. Chairman, that is my report.
Thank you. Good report. All right, is there any other business? Our next Budget and Finance Committee meeting will be on May the 20th, and then our next board meeting will be May the 23rd. Same time, same place. All right, thank you all for coming.
Thank you.